So we know that after your surgery, there are some very rare potential issues or complications that may arise. So we're not saying that this is going to happen to you, but it's useful to be aware of what can happen. So some patients do suffer with a little bit of wind pain, and this is again quite normal. They fill you up with a lot of air during the surgery anyway, and then after your operation you still have that air inside you. A lot of people will complain of almost kind of like shoulder tip pain. It's referred pain from the wind. Doing some of the exercises that we show you later in the presentation can help that. And the nurses may be able to offer you peppermint tea as well. So if you are struggling with wind, do let them know. But again, this is another reason why we like you to get you up and walking about early to get rid of that excess wind that you might have. You may experience some pain and swelling around the wound site. So again, if you don't feel that your pain is adequately controlled, then do mention this to your nurse. There may be something else that they can suggest for you. Again, your catheter will be in place. You need to make sure that you're drinking plenty, so make sure that you're flushing through the catheter to avoid complications. You may need to drink a little bit more than you're used to just to help with this, but as long as the catheter is flowing well and urine is collecting in the bag, that's all good signs. You may also experience a little bit of vaginal bleeding or discharge from the vagina, and potentially some bruising around the wound site as well. So again, this is all quite normal, there's nothing you need to panic about. But if your vaginal bleeding is excessive, you may need to get in contact with your specialist nurse. We do advise with your wound, it's useful to know that it's with glue and not stitches. So keep the area nice and dry and open, let air get to the wound to avoid any complications. You're allowed a shower, but you may not want to get the area too wet, but you're definitely allowed to shower, and just pat dry the area afterwards rather than excessive rubbing. The last thing I'd like to mention is constipation. So we have already talked about tips to empty your bowels as best you can, but we know that being in bed for long periods of time and having surgery, your bowels can take a little bit of a while to get back to their normal routine. So again, do flag it up with the nurse. If you're worried, they do prescribe you laxatives. But keep an eye on your diet as well. There are things that you can do, as mentioned later on in the video.